Poverty definitely has a significant impact on health outcomes at many levels, from being able to access healthcare, to being able to access a healthy environment, having access to quality food, having access to safe housing. And with poverty, sometimes we see that people they have high risk of suffering from violence. And there's studies showing that people going through poverty have a higher levels of certain hormones like cortisol that can predispose them to mental health problems, but also metabolic problems.
And the research is helping to provide the evidence base that there is a problem, right? So you can't tackle a problem if you don't know it exists. And so we, in part, try to document what are some of the challenges, the health challenges, the public health challenges facing different communities.
The Health Frontiers in Tijuana was created as a true partnership with a collaboration between a students organization and faculty from UCSD, and also students from UABC who wanted to take advantage of research that was coming out on the border region that was showing global health problems or issues that were being published. And they wanted to learn about global health in a very close area.
The HFiT clinic has an important impact on the health and well-being of patients. These are very structurally vulnerable patients that are oftentimes excluded from community services. They're not able to access them because of stigma, discrimination, and structural barriers like lack of identification and lack of health insurance coverage. So the HFiT clinic really serves as a safety net for this really wide array of patients, from U.S. nationals to migrants to deportees to other refugees, asylum seekers, veterans from the U.S., military services, transgender individuals, and persons that are living with HIV or at risk of HIV. The clinic provides not only primary care, but tries to fill in as much as possible mental health services utilization, by supporting psychological services at the clinic.
The students play a very important role in the clinic. The clinic was created as a hub for providing needed services for very vulnerable populations by the U.S.-Mexican border, but also as a hub for experiential learning in global health. The nuts and bolts of the clinic are students.
Students that are interested in joining the clinic maybe are interested in health professions, including nursing, medicine, psychology, social work, dentistry, and other allied health professions as well. One of the nice contributions of the students is that they're able to bring in their passions to the clinic and create new programming. So what that looks like, for example, we had a student recently that was very passionate about bringing mindfulness and meditation to other refugees and patients that are coming through the clinic.
In order to have better outcomes, it's not only providing medication or providing clinical intervention, but having the patient learn about how to take care of themselves, learning how to navigate the very complicated health systems that we have in both sides of the border, especially for migrants, is a very important service and learning for patients that help them improve their health and prevent adverse health outcomes.
One of the really interesting points that we have learned is that some of the patients that we see at the HFiT clinic have had residences throughout the United States. I mean, it's not concentrated, let's say, just in California or just on the West Coast. We've had people that have lived in the South and on the East Coast and all around the U.S. And really what we are talking about is a shared patient population, so that the more that we do on the U.S. side to care for structurally vulnerable populations, for those that are uninsured or that have barriers to accessing health care, the more beneficial effects we will have in terms of improving health on both countries. In the HFiT clinic, to the extent that we can, we try to integrate as many, disciplines as possible so that it's a one-stop shop for the patients and they're getting integrated care where doctors are able to communicate with each other to provide the best possible care.
AYA has done a tremendous help for us to provide additional services that are not being provided currently to people that do not have any insurance or that are migrants, and able to, promote healthy communities.
To be more concretely specific, we're able to purchase an ultrasound. Again, these are communities that are foregoing using maternal and child health services, prenatal care. And we know that that's not a good situation for moms to be. So through this contribution, we're able to meet that gap in service.
So thanks to the help from AYA, we're going to be able to provide this service and be able to prevent either from not identifying a severe case and having a bad outcome, or identifying a severe case and not overwhelming the health systems or hospitals, sending more, but very few people that really require additional services.
I think it's a tremendous asset to the region and to, both countries, really. There's a story behind every person that's coming to the clinic. And I think that humanization, that's an important piece of it. The other piece that we do, that we tackle academically, is that the clinical activities are complemented and supplemented with coursework at both universities. And so we can help to destigmatize through education of the students, but we're also educating community members at the same time through the work that we're doing.
And then we can change the perspective, of the community, patients, and our students and future professionals to think as a clinician, to think as a health promoter, and then how do I link people to the care they need?
We're looking at this as a case study, but the issues that we see, we know are not limited to this region, but affect many communities around the world. And perhaps we can help to come up with creative and, innovative solutions to those problems that we can share with other communities.